governments spend less than 1% of their health budget on mental health. And that is just not sufficient to provide the services that we need. Being in India, as a clinician, one has more patients than one can imagine in the West. I would see on an average about 80 to 100 patients.
Wow.
There is no other reward compared to a person coming back after 2 weeks and saying, "Doctor, I'm feeling much better. Thank you so much."
Yeah.
That's not there in policy area, not there in global mental health at all.
Yeah. A very warm welcome to you today. This is the podcast of the Flourishing Minds Fund. And today we have a very special guest, Shekhar Saxena, who is the Professor of Practice of Global Mental Health at the Harvard T.H. Chan School of Public Health. Wonderful that you could be with us, Shekhar, and thank you so much.
Thank you so much, Chris, for inviting me. It's such a pleasure to join.
Thank you. You know, obviously, there's a great deal to discuss with a person who has had such an impact on the global mental health space. And clearly, I want to jump into some of the major achievements in your life in relation to the World Health Organization and so on. But before we do that, I wondered whether you'd be good enough to describe a little bit of your early life in training, psychiatry, and so on in India. Would you like to jump in there and just give us a little bit about your early career?
Sure, Chris. And also just to say that I've known Chris you for many years, many years, if I can say that. And it's such a pleasure to not only be on the podcast, but to be on the podcast with you, who also has such a large footprint on global mental health. But to come back to your question, yes, I grew up in Central and North India and took up medicine as my profession. So did my undergraduate training in medicine in New Delhi at an institute called the All India Institute of Medical Sciences, and then picked up psychiatry as my subject of choice for my specialist training. And this was a very considered choice on my part, but certainly I wasn't commended on that choice by my family and friends, who either thought I had gone mad or thought that I had not fully utilized the potential that I had. And I must say that over the years, I look back and think that I couldn't have made a better choice. So I'm very comfortable and very happy with the choice that I made to join psychiatry. But obviously, as we will discuss later on, I moved on to mental health as my area of activity, which, as you know, is much broader than psychiatry, and that worked out just fine for me.
Yes, absolutely. I suppose in those early days, it's probably worth saying this, in those early days, people felt that going into psychiatry was less a field in some ways. Is that right?
That's right. Its potentials had not been realized, in fact, perhaps not at all. But also it was stigmatized because the stigma attached to mental illness and those living with a mental health condition also gets attached to the people who are looking after people with living with mental disorders. So, and also it was very understandable because mental hospitals were built outside the city and nobody wanted to go and work there. So it is understandable at that time. But obviously, as you know, things have changed a lot. Not as much as one would like to see, but still a lot of progress has been made. So if a young person made that choice now, perhaps the reaction will be much more welcoming than at that time.
Yeah, yeah, absolutely. What was it, in fact, that attracted you in those early days?
Having chosen medicine as my profession, I was still not quite comfortable with the biomedical model that almost the entire medicine area follows, and I wanted something more to do with mind and with society and with culture
Ah,
and with the way people think and behave rather than taking them as a body with a mind behind it. I wanted to take the mind in front, and psychiatry offered that opportunity, and I grabbed it.
yeah. What a wonderful way of describing it. Yeah, I can see that. And I also, in my own way, um, vibe with that. That seems very appropriate, but quite brave in those days to go against the strain, as it were.
True, but as I said, no regrets at all.
That's great, great. After you finished your basic training and then your psychiatric training, you served in India for quite a while, I think. Where were you serving and what were you doing?
I worked at the same institute where I got my training,
Mm,
and this is a specialized hospital and a training center, perhaps one of the most famous ones in
mm,
India,
yeah.
in New Delhi.
Mm,
And I worked as a resident and then as a faculty
mm,
for a period of 20 years.
mm,
And this was my time to hone my skills as a clinician and to help people with mental health conditions, but also do teaching and research and even some policy advice. So it was a full agenda and very, very interesting. I must say that I derived the maximum amount of pleasure in looking after patients.
mm.
And being in India as a clinician, one has more patients than one can imagine in the West. So on a regular outpatient day, starting from around 8:30 to finishing around 4:30,
Mm,
sometimes without lunch,
mm.
I would see on an average about 80 to 100 patients.
Wow.
One could say that you can't do justice to all of those people with a very short amount of time that is available.
Mm,
But it does two things. One, that it provides at least some basic care for people who perhaps would not find it anywhere else.
mm,
And the second, one develops a clinical sense and expertise that is very precious because one sees lots of patients with all varying kind of presentations,
sure.
and the experience that one gets is really fabulous. So I did gain from that, but I also enjoyed it thoroughly. There is no other reward that I know of compared to a person coming back after 2 weeks and saying, "Doctor, I'm feeling much better.
Wow.
Thank you so much."
Yeah.
That's not there in policy area. That's not there in global mental health at all.
Yeah.
So I did enjoy that. But I also should add that that kind of clinical experience is also very precious for public mental health.
Mm,
After all, public mental health is population mental health, and population consists of people,
mm,
real people with
mm,
real problems.
mm,
So, during my later part of professional career as a public health professional, I carried those faces, those people, that experience with me, which I think was extremely useful. I saw public health problems as an aggregation of people's problem, which unfortunately some public health professionals do not have the privilege of having. So I must say that that was a very good period and I enjoyed it thoroughly.
Yeah, I can imagine. Well, you sound as if you did, which is, great. It's lovely to hear you be so enthusiastic about that period of your life. Absolutely, I can see that. Um, uh, and having people come to you and say, thank you, very simple, straightforward way, having helped them in a very practical way must be very pleasant. I think must be really must feel like a real achievement.
It was, and again, that continues to be the case now for people who are working in the clinical area. As Chris, you have developed a lot of clinical services over the period of time,
Mm,
not looking after people yourself, but developing that. I think
mm,
it has its own rewards and
absolutely.
very much valued that experience.
Yeah, absolutely. So it was whilst you were in that, or towards the end of that period of service, that you then obviously traveled and started uh, to become involved, as I understand it, with the WHO at that time. Is that right?
That's correct. I did a couple of projects for WHO, and then WHO invited me to join as a staff member, and I moved from Delhi to Geneva and worked there for the next 20 years' time,
Mm,
uh, looking after no patients at all, but doing public mental health and advising governments and other sectors in how to organize services. So I moved from delivering services to helping countries and organizations organizing services,
mm,
which was a big change, but I must say that it has its own rewards. So I did technical work, I did managerial work, and I did consulting work,
mm,
consulting to governments
mm,
essentially,
mm,
and took on later during the last 8 years of my stay in WHO, took on the role of the director for the Department of Mental Health and Substance Abuse, and in a way led the team. I should say rather a small team at WHO to advance the global mental health agenda in the world, and that was again a very good period of my life. And I remember very fondly that that's when I came in touch with you
mm,
and with many other people who were striving towards the same objective. And
mm,
it was such a pleasure to work with a very diverse group of individuals and organizations
mm.
to achieve what I would say are significant achievements in global mental health, but totally as a part of a team.
Absolutely. Absolutely. I always remember the team being, I agree, it was quite a small team. Um, but I also remember it being very expert, incredibly competent. And that was always uh, really an impressive aspect of this particular group of people within much larger organization and teams within WHO. Um, did you always feel that you had enough people with you, or would you have preferred more? How did you feel about
Enough, not at all.
it?
For the tasks that were required
Mm,
from us,
mm,
we were far too small. So
mm,
we could do some basic tasks, and I should also add that working for the World Health Organization was such a privilege for me as well as for other people.
mm,
So we had to perform well, and we had to perform well all the time, and we had to work very hard.
yeah.
But with that, in spite of the small team, but a very diverse and, as you say, very competent team,
Mm,
we were able to take forward the agenda in a substantial way. If the team was larger, perhaps we would have achieved even more. But
mm,
we have to live within the constraints of the organization that we work with under the governance of the of the countries.
Mm.
And so we did what we could, but I feel very proud of being able to achieve quite substantially during that period. And I must say that WHO continues to do well, which gives me great pleasure.
Yeah, absolutely. No, I really admire the team even today. It's true. Absolutely. Um, why don't we just look at a couple of the achievements that you feel particularly proud of, or that you feel are particularly important, that you were able to accomplish with the team during that period?
Chris, I think overall, the best part of the job, as I said earlier, was to be able to work with a very diverse group of individuals from all across the world. So,
Mm.
various cultures, various languages, various backgrounds, people who came from these very different organizations. It was a reward in itself
Mm.
and an achievement in itself because one had the opportunity to provide them with technical advice as well as support to be able to achieve those objectives. So I would say every day was a beautiful day. But I would say that a few things that happened during my time in WHO are remarkable. One of them is that we were able to take, even within WHO, which had not taken mental health as a very substantial priority earlier, we were able to give it a better prioritization and within countries, and which culminated in a way in 2013
Mm.
as the adoption of the mental health action plan
Yeah, I
that was
remember.
passed by the World Health Assembly, which consists of ministers of health of all countries,
Mm.
193 at that time,
Mm.
and they all shared the same vision, the same mission, the same objectives, even the same targets for the world, which I found to be very substantial and very rewarding in a way.
Yeah.
It was again a very much a team effort, but that comes to my mind as the highest political level of engagement
Mm.
for mental health that had happened till that time.
Yeah.
So that I feel is something that we all can be proud of, and I know you were around at that time, also
Mm.
contributing to the effort.
Mm.
And that action plan, which was initially for a period of 8 years,
Mm.
it has been extended now. It's till 2030. It's well aligned with the United Nations Sustainable Development Goals. And I must say that the commitment that countries have shown to the action plan has resulted in enormous increase in the mental health services that have happened in the countries. And I should say perhaps millions of people getting better care.
Mm.
And so, what I could achieve looking after patients one after another in India could perhaps be multiplied by organizing services and expanding services in a way that many more people could receive the kind of services which I was rendering in my earlier life.
Yeah.
So that I count as a major achievement of WHO at that time, and
Mm.
I'm happy to have contributed to that effort.
Absolutely, and why not? Gosh, I think that was a major achievement, a major achievement. I remember actually being present when that was, on one of the benches way back. But I remember being present at that time, and as it were, the gavel going down, and the actual plan going through. But I particularly remember the many energetic discussions that took place in developing the plan. I think that was so interesting and intriguing from my perspective. Yeah,
Yes, true, because getting the draft to a stage that all countries can actually sign off on
I know.
is extremely, I should say, political process, and one had to take care of all concerns and all compulsions of the countries and derive a draft that is acceptable to all. We did lose a few things, but I must say that the vast majority of details that the technical team in WHO wanted to have in it were actually accepted. So I think it worked out very well. But you asked me about the experience of several types, which I remember. I think one of them is the action plan, but the other one is actually groundwork, traveling to countries and providing the kind of support that countries needed. All countries, high income countries, middle income, and low income. I traveled to around 100 countries during the 20 years of my time in WHO.
Wow, 100.
And that's correct, yes. And again, it was such a good experience because the countries differ a lot from each other. Some of them are very small, some of them are very large. They speak different languages, they have different healthcare systems, and obviously they are at various stages of their development for mental health services. And that really provided an enormous opportunity to make them do better from wherever they are. I remember going to Japan about 5 times and trying to help the government of Japan in decreasing their suicide rate, which was and continued to be pretty high, and giving them examples from other countries which had done better. In the middle income countries, I remember going to very big countries like China and India and Brazil and Mexico and trying to help them. I'm using the word trying because that's exactly what it was. Sometimes you succeed, sometimes you don't, but you continue to try. And low income countries, like many of the African countries where mental health was really confined to one or two mental hospitals, and there was almost nothing outside. A country with 10 million people with one psychiatrist. That's the kind of situation that one is dealing with. And so one had to really make a complete change in the frame of mind when one traveled from one country to another.
Exactly.
And that was a very, very good experience and very rewarding to be able to make some differences. As I say, in public mental health, you try 10 things, 8 of them perhaps fail. One of them succeeds a bit, but the one thing which succeeds really gives you the returns for all of the investment.
Yeah, absolutely.
And that's what I experienced in real life. So that was also something that I remember very clearly.
You must, considering those situations where there were very few mental health specialists, maybe one psychiatrist, as you said, you must have felt like the cavalry arriving. It must have felt like, that you were coming over the hill and really providing some support at a time when they may have felt really on their own in many ways.
Yes, it was interesting, but in many cases very frustrating also. But one keeps trying. I remember going to a mental hospital in an African country where, not to talk about medicines, there was no running water. And so, as a public health professional, one has to look after all the needs. And the first on the agenda was to actually buy a water tank and get it installed on the roof so that patients can have drinking water and water for bathing. And then talk about medicine. So that's exactly what it was. Taking problems one at a time. And seeing how best to change that. But also, I must tell you that one of the most challenging situations was to deal with emergencies, humanitarian emergencies, whether they are natural disasters or conflicts and wars, which, as you know well, create their own share of mental health issues,
Yes, yes.
which become, and especially if the catastrophe are ongoing, which put enormous burden on society for mental and psychological issues, and to assist countries sometimes in the middle of a crisis when the country is dealing with a lot of other issues, to put
Yeah.
mental health on the agenda and do something very concrete which can help
Yeah.
is in itself a great challenge. And I must say that me and my team were able to go to dozens of places where our help was needed, and to be able to provide that kind of help.
Yeah, absolutely necessary, very vital, absolutely. I can remember in Sri Lanka, when the tsunami came, the big tsunami came, and I can remember various colleagues in the government service uh, losing, in one case, for example, a gentleman psychiatrist. He went and made his rounds, and during the rounds, the rest of his family was killed in the tsunami. So it was an extraordinary situation, and our little team and the basic needs team in Sri Lanka, were involved enormously with government service and other people who came to help at that time. Absolutely, yeah.
Chris, in fact, I remember your work in Sri Lanka and my team's work. The tsunami struck in the last week of December in 2004,
Correct.
and I was in the country within 2 weeks of that,
Amazing.
just trying to help the government in organizing services, because it was a very major natural disaster with thousands of people dead and tens of thousands displaced.
Yeah.
And it was an enormous job for the government to do. But interestingly, one of the major issues at that time, in the middle of the acute crisis, was that there were many people trying to help. In fact, dozens of team landed in Sri Lanka from outside, trying to help, and many of them were very well intentioned, but not very helpful actually, because they didn't speak the language, they carried the wrong supplies. Sometimes there was a team of, I remember there was a team of 20 psychologists coming to the country, not speaking any of the local languages, and actually counterproductive, because they consumed the resources of the society in
Yeah.
terms of translators and other people, which could have been used much better ways. So one of the tasks in front of our WHO team was to actually tell the government to organize themselves in such a way that they had the final say about who comes, who does what, where, and for how long.
That's right. Yeah, I
And
remember
that
that.
is the kind of engagement that we need with the civil society, so that they serve to strengthen the system rather than to divide the system, or
Yeah.
to diversify in a way that is not very helpful.
Yes, exactly.
And that was, again, a very interesting experience, I must say, based on your work and WHO's and many other organizations, that Sri Lanka Mental Health Services now, 20 years from that time, are definitely so much better
Yeah.
compared to that time. So, in a way, a crisis many times is actually an opportunity to provide a much better healthcare system for mental health than the earlier time. Sometimes you have to shake the system, and crises do that, however unfortunate they may be. But sometimes they are an opportunity to put mental health higher on the agenda, and it worked very well
Yeah,
for Sri Lanka at that time, at least for mental health.
exactly. So thank you so much for that really uh, evocative and attractive explanation of your work during the time that you were at WHO. You've now gone to Harvard and you're a professor there. Um, what are your main duties there? What are you absorbed in mostly?
I do remain a public mental health professional. So my primary duty in Harvard, and I am a faculty for the Harvard T.H. Chan School of Public Health, is to teach. A university teaches, and I teach. So I run two courses on global mental health, which are attended by primarily Masters of Public Health students, but also some others. And I inject a dose of global mental health into their curriculum,
Okay.
so that wherever they go, whatever they do, some of them will do their PhD and become professors. Some of them will join a public health organization, either a national or international. Some of them will join actually private companies, which are increasingly influential in the area of public health. They carry some of the basic messages from mental health area. How to organize services, how to evaluate the impact of interventions, how to have programs that can actually benefit the largest number of people, how to provide basic services, how to reduce stigma, how to look at cost effectiveness of interventions and programs. How can the precious dollars go much farther in reducing disability, in empowering people? Those are the kind of things that I teach. And I must say that the students love it. I love it more actually, but it has been a very rewarding experience again for the last 6 years that I do teaching. I do other things. I mentor students as well as junior faculty members. I do also advise governments on policy whenever opportunities arrive, and also help to build a team that can take the public mental health agenda in an academic setting to a higher degree and higher prioritization. So these are things that I do, and and yes, it's again a good phase of my life, my third phase, as I say.
That's great to hear. When we were preparing for this talk today, when you and I met to prepare for it, you at one stage you were musing on the sort of role of philanthropy in the provision of global mental health, to put it in a simple way. Would you care to just to expand that musing a bit and develop it a bit? Because I think it'll be interesting to our listeners.
I think mental health field, as we were discussing earlier, has grown a lot, and many other stakeholders have joined and are contributing a lot. So, besides the government, that should provide the services, in many cases they do, and in many other cases they don't. There are other stakeholders which have got in. Of course, professionals like psychiatrists, psychologists, and other professionals are a big stakeholder. Then there is the civil society as a stakeholder, which has again grown a lot. Then there are people with lived experience or living experience that also are contributing quite substantially lately, and they're organizing themselves better, which is very good because they must. There is nothing that should happen for them without them. And so that is all, those are all very good developments. But development funders, the development banks, the bilateral funders, they're also very active now, which is good. But the last stakeholder that you mentioned is the philanthropists. We know that a lot of money has gone into health during the last 20 years from philanthropic organizations, including foundations. Unfortunately, a very small proportion of that has gone into mental health. The proportion is less than 1%.
That's right.
Which is very unfortunate. So mental health is actually lagging behind compared to other health areas in this field. Philanthropists can and should have a very large role in neglected health conditions like mental disorders. They obviously are not replacing the government. Government should have the primary and long-term responsibility for their citizens' mental health, but philanthropists can play a very good role uh, for the time being in terms of providing assistance when the government is missing, uh, carrying out demonstration projects which can show the way forward,
Yeah.
uh, to do capacity building, for example, of civil society, but sometimes of the government professionals also, and so on. And that is something which has also grown, but can grow much more. So I would feel that an increasing number of philanthropic organizations, including foundations, need to play a bigger role, more especially in low and middle income countries where the needs are much higher.
Yeah.
So obviously, all countries are developing countries as far as mental health is concerned, and they all need help. But I think there is a very specific role for philanthropists to assist countries which are in maximum need at this time, where the gap between what is needed and what is there is the largest,
Yeah.
and pick up those areas where they can make a very quick and a very substantial contribution.
Yeah.
And in that sense, I really feel that organizations like the Flourishing Mind initiative that you are involved with, and I'm also involved with a little bit, is to be appreciated very much, because the available monies are being used in a very thoughtful manner to fund organizations that can make a very good contribution to the areas. And sometimes these are very small local organizations which nobody else knows about.
Yeah. Yeah.
And to be able to find them, to be able to assess their value, and to be able to support them, I think is a very noble cause. So I
Right.
do appreciate that, and I hope such initiatives grow in number and also grow in size, so that we can make a much quicker progress on mental health than we have been able to make.
Absolutely. Yeah. I think it is an important feature. Um, uh, my last question to you would be as follows, which links to what you've just been saying. Um, in the old days, there was a criticism made by funders, which philanthropic funders in particular, which made them slow to come to the party, which was that the evidence produced of progress or success was not as compelling as the evidence in other areas of health. Now, I always had, I always felt that was probably both a sincere criticism, based upon their own research. But I also felt sad because I was aware, of course, that many people who had done much research and had worked on evidence producing impact statements and so on and so forth. What's your approach to that?
I think some many of these are born out of lack of information, or sometimes even misinformation.
Mm,
I'm not claiming at all that we know everything. We don't.
mm,
And there is a lot to learn, there is a lot to know more.
mm,
But my question is, are we using the knowledge that we already have? And the sad answer is not.
mm,
And there are many constraints, there are many limitations in using knowledge that we already have.
mm,
And one of them is the financial resources. We just lack money. Governments spend less than 1% of their health budget in many cases, not in all, on mental health. And that is just not sufficient to
no,
provide the services that we need.
mm,
So, my message to the philanthropists and other stakeholders would be that let's focus on what we know and how to implement that in the most efficient manner. We need more dollars, but we also need to know how to spend those dollars. Where will be the maximum benefit?
mm,
And both the quantitative data, which we have quite a bit of it now,
yeah,
as well as qualitative data.
mm,
Is it helping people? Is it helping people in their real needs? Are people getting back to their life? Are they earning money? Are they feeling more better, and are they able to contribute much better to their society, to their family? Those are the questions that we need to answer. And so, yes, we need better evaluation, but we also need better communication of those findings to the people who are willing to invest in it. And I'm using the word invest because it is actually an investment into the capacity of people, into society. That's what we need to emphasize.
Absolutely. Shekhar, I could chat to you all day. And I realize that we are getting to the end of our session, I'm afraid to say. I just wanted to ask you, as you stand back and you look over this career that you've been generous enough to share with us today, what are your thoughts? What are your thoughts as you stand back and look at it all, from that first period of going into psychiatry when people were a bit quizzical or even more than quizzical about it, right the way through to your professorship today? What are you thinking?
I think we have made tremendous progress. So I'm happy about that, but I am also optimistic about future. And what gives me that hope? What gives me hope is to see that a very different kind of people and diverse group of people in organizations are actually realizing the importance of mental health. I, as a mental health professional, have talked about this for a very long time. You could ask, what else would I talk about? But what I'm happy about is that a lot of other people are talking about who are not mental health professionals, but they now understand mental health better. They are willing to realize the importance of it. They are willing to contribute to it. And we need all of that expertise. But most of all, we need the contribution and engagement of people with lived experience. And that to me gives me even more hope because I see a lot of people coming out and saying that they had a mental health issue, they were able to deal with it, and they are willing to help other people of their kind. And that's exactly what gives me more hope. So, yes, I must say that the future looks optimistic to me, and I look forward to many more young people joining the profession of mental health as well as global mental health to make their contribution, and that will be a good thing to happen.
That's great. I know that when people watch this podcast, they sometimes would like to write to the speaker, in this case yourself. Is that possible in your case? Would you accept an email from somebody who had a serious question to ask you?
Absolutely. I would welcome any questions or comments on even sharing some experiences, and I'll share my Gmail with you, and that can actually be part of the podcast.
Great.
And I'll really be happy if people write to me. My only caution is don't write to me asking for advice on clinical matters. I don't do that anymore. But on public health matters, absolutely yes. And I must say, it's such a great pleasure to talk to you, Chris, on some of these aspects.
Oh, well, thank you very much indeed. So, on behalf of everybody watching, thank you very much indeed, Shekhar, for a wonderful session. And we look forward to being in touch in the future.
Thank you, Chris, for giving me this opportunity. Thank you.